Hello, welcome Facebook family. So sorry for getting started late here. My name is Dr. Lahnor Powell with Genova Diagnostics. I was not able to technically figure out how to do live feed on both platforms, Instagram and Facebook at the same time, so I'm just doing it separate. But welcome, thank you so much for joining me today. What I wanted to do today was talk a little bit about glutathione. The reason I wanted to talk about that is because it's such a powerful, awesome antioxidant, and I just wanted to piggyback really off of Dr. Brown's talk yesterday where he discussed oxidative stress, the free radicals, and he talked about 8-OHDG and lipid peroxides as being indicators for having higher amounts of oxidative stress. But one of the great benefits of glutathione is that it can actually help reduce that oxidative stress. And just for a really quick recap, what is oxidative stress? So basically it's an imbalance between your body's ability to fight free radicals and the production of free radicals. So basically you have more free radicals than your body is able to fight away. And the issue is that it can actually increase your risk for various diseases such as cardiovascular disease, cancer, inflammatory disorders, chronic fatigue, infertility as well. And so basically what we want to do is we want to try to level out the production of oxidative stress with our body's ability to fight those free radicals. And the way in which we can do it, or one of the ways, is glutathione, which is again awesome antioxidant. So glutathione is a molecule that is really 3 amino acids squeezed together. So it's glutamine, glycine, and cysteine. Those are 3 non-essential amino acids that your body typically will make, and that to some extent we can get from the diet. But we take those 3 amino acids and squeeze them together with magnesium, B6, as well as zinc to make our glutathione molecule. Now, we can actually have lower levels of glutathione if we are stressed out, if we have poor nutrition, if we are exposed to environmental toxins, or as we age, and even if we're not sleeping well or we have insomnia. Those are cases why we may have lower levels of glutathione available. So at Genova Diagnostics, we measure glutathione directly using blood, whole blood specifically. So we look at the total glutathione, which is the oxidized plus the reduced form of glutathione. Now that's important to note because the oxidized form of glutathione has already given its electrons away. We can't use it anymore versus the reduced glutathione, which has amino acids to give away to help quench those free radicals. And so what we want to always make sure is that the body has the adequate resources to move that oxidized glutathione, which we don't use, back into that reduced form of glutathione. And the way in which we do that is alpha lipoic acid, vitamin C, selenium, even milk thistle can help as well. So again, when we measure glutathione at Genova in blood, we measure total glutathione, so both the oxidized and the reduced forms. So I know right now we're in this big stay safe, collect at home initiative where we're really encouraging people to drop ship to their patients saliva tests and tests that we measure using urine as well as stool testing. And so it's like, why, Dr. Powell, are you talking to us about a blood test? Well, actually, with nutrition testing in urine, there are markers that can give us insight into the need for glutathione that we might want to consider looking as well. So specifically for urine testing, like your optimal nutritional evaluation or the one test, as well as your organics test, we look at 3 specific markers. Number 1 is pyroglutamate or pyroglutamic acid. That is involved in the process of making glutathione. The other thing we look at are amino acids. Again, amino acids help build glutathione, so we need to make sure we have enough of them. And lastly, we look at oxidative stress markers, the one that Dr. Brown spoke about yesterday, lipid peroxides and 8-OHDG. So as we see changes in the in kind of the patterns of those different biomarkers, that's where we can kind of get the information information or insight that, maybe you do need a little bit of glutathione. And so in urine testing, the way that we go about it is by looking at organic acids. So let me just tell you what that is. Organic acids, they are compounds that are measured in urine, and it provides us hints into various biochemical pathways that occurs within our body. And from that information, we're able to gain insight into nutrition need, hence glutathione and other nutrients like B vitamins and antioxidants and stuff like that. Okay, so again, the optimal nutritional evaluation profile, which is a urine-only collection, as well as the organics profile, can definitely help us to better understand how we doing with our glutathione. Now, if we identify that we have a need for glutathione, there's a few food sources that I'd like to kind of inform you about. What's really cool is glutathione has a sulfur molecule, and so your sulfur type foods help to boost glutathione. That includes your cruciferous vegetables like broccoli and Brussels sprouts. It includes your allium vegetables like onions and garlic. It's also things like eggs and nuts and legumes and other herbs like milk thistle and flaxseed. They can help boost your levels of glutathione. And we can also give glutathione directly. We can either do that through IV or intravenous. We can do it IM or into the muscle tissues, as well as nebulized where it's aerosolized and we breathe it in through our respiratory tract, also orally and then topically. Those are different methods that we can directly deliver glutathione. There's a few side effects that have been noted, but it's things like upset tummy and cramping, and some people might have an allergic reaction to it. So this is why we always want to seek advice of our healthcare practitioners in terms of dosing and is this the right supplement for me. There is a group of people that we do exercise special precautions in, and that is your pregnant and your lactating females. The reason being because there just isn't an abundance of literature that speaks to the safe or the effectiveness of it during those time frames in women's lives. But that's pretty much it. I just wanted to talk to you a little bit about glutathione. If you want to know more information about how Genova Diagnostics is supporting our clinicians and healthcare practitioners during their transition into telemedicine, please give us a call. You can call customer service at 1-800-522-4762. You can also go on our website at www.gdx.net, and we will provide you some further resources how we are drop shipping kits to your patients and things like that. Well, it's been real. It's been fun. I hope you guys have a wonderful day. Please stay safe. Please exercise caution. Please be smart and have a wonderful day. It's been a pleasure. See you next week on Thursday.